Welcome to Yale! I love being here at Yale because we have such a great community of attendings and co-residents to work with.
And I love that we get to see so many diverse pathologies, and the community here at New Haven is also very diverse.
Yeah, and I love the fact that we have the best residents who are always very engaged. And one of the really cool things about our consult service is that they get to work together.
We know.
Yeah, all the time.
A lot of fun together.
One of my favorite parts about being a first year at Yale is that when you're on your clinic block, every Friday you have a PCC clinic, which is basically like your primary care clinic where you have all of your own patients. So the schedule is your own, any labs you do, any biopsies you do, those are yours, you own them. And every other week we also have a pediatric clinic that's exactly the same. I think what struck me the most when I came here was that they are literally your patients from the first day that you show up from in July to the entire rest of your time. You get to know those people, you have to call them back for different results, you have to kind of work your way through different treatments that they're trying that are working, not working. You can really see what effects your management is having on them.
It's a great opportunity for us to practice seeing patients and practice developing treatment plans and taking ownership of patients. So it's great being here at the Primary Care Center every Friday.
We have a lot of good opportunity just not only from our own physicians, but from visiting physicians who come, so you get to see how different people practice outside of academia as well in the community. And you can see a lot of very interesting cases here.
I think one of the big things is the amount, or sort of the balance between autonomy of your own patients, having amazing continuity clinics, both ped and adult, which is really rare, but balancing that with being able to see these experts, specialty clinics, you know, from CTCL with the people who basically discovered it, to Ebolas clinic, to pigmented lesions with Dr. Bologna. I mean, it just ranges the full gamut, and so we get this really nice balance between ownership of our patients and then seeing the experts do what they do.
I'm currently on Consults 1, which means I cover the main Yale New Haven Health Hospital, which is right behind us. So on Consults 1 rotation, I really get to see all the inpatient consults during the week. It's a very busy service where you learn a ton of kind of bread and butter derm, and also you see some really sick patients. Right now we have a patient who has mucor, we also see someone with retiform purpura, and of course drug rashes. We have really strong inpatient faculty here, and it's I think a highlight of the program.
This is SRC, which is one of the hospitals that we cover during our inpatient dermatology rotation. We help out at the big hospital on York Street, and then we come over here to help see and cover this whole hospital. You never know what you're going to get here, and you never know when you're going to get it, but we've seen some really interesting cases, some really exciting pathology, and I think you guys are going to really love this rotation.
Just wanted to explain how amazing the surgery rotation at Yale is. You get to work with excellent Mohs surgeons and cosmetic dermatologists. You get to do Mohs surgery, excisions, the lasers, fillers, and Botox, you name it. And the hands-on experience is awesome here. So come to Yale.
During the dermatopathology rotation here at Yale, you get to spend a lot of time around this scope with amazing dermatopathologists, as well as our DermPath fellow here. We basically get to see sign out every day where you go through, hundreds of cases essentially, and you get a great explanation of what you're looking at under the scope from the attendings. We also have amazing DermPath training here in general. We have multiple lectures on our academic day. Every Friday morning we have time with our fellow where there's unknown slides that we get to look at. And it's a very supportive environment. No one expects you to know anything, but by the end of the first year, you know a lot of dermatopathology. We're really trained well here. I personally love it. I'm planning on doing a fellowship in DermPath myself, partially because, the great training here is really inspiring and gets you excited about this field. So definitely consider coming to Yale if you have any interest in dermatopathology, because we have a great department here.
The research program here at Yale is a 2+2 program. The first 2 years are identical to your non-research peers, and then PGY4, and the following year you have an opportunity to immerse yourself into dermatologic investigation. You can conduct basic or translational research with one of the research faculty in the Department of Dermatology or at Yale in general.
This morning I'm headed to my VA continuity clinic. Each resident has a VA continuity clinic on either Monday or Thursday at the VA in West Haven. And we have the opportunity to really develop great longitudinal relationships with our patient panel there at the VA. I actually have a few World War II veterans on my panel, some amazing 90-plus-year-olds that we get to do skin cancer screenings on, and also that we get to have a huge role in doing surgical excisions on. On Tuesdays, we have surgery days at the VA where we work with our Mohs fellows to do surgical excisions, laser procedures, ED&Cs, and the sort for our patients at the VA. It's a really rewarding experience, and we're really lucky to be able to have such an integral role in the care of the veterans at the West Haven VA.
I'm one of the senior residents in charge of cosmetics clinic. As you can see, we have a really diverse experience featuring the full range of cosmetic products. We have a number of amazing teachers here, ranging from our own in-house cosmetics expert, Dr. Swosey, to visiting professors from New York and Boston who come down and give us a great experience. We also get some hands-on training with laser, and we get to do other injectables like Sculptra and Kybella. Hope you come here.
Yale is such an amazing place. There's the people at the top of their specialty, but they're also down to earth, kind, excellent teachers. You're learning so much every day. You're seeing more here than I think you see anywhere else.
Great exposure to a wide array of clinical issues. And like she said, we have professors and I guess we should say physicians, attending physicians that we work with who have literally written the chapters in the dermatology textbook. Literally, it's called Bologna for a reason.
I lived in Boston my entire life before coming here, and I've absolutely loved being in downtown New Haven. It's very easy to live there. You walk right outside, you have the street of every restaurant you would want. Food is much better than in Boston, I will say. There's really cute walks you can go to. You can walk through the Yale campus, which is absolutely beautiful. And then if you want to venture a little further out, there's a lot of nice hikes and parks and things to do. Driving is very, very easy. There's multiple garages where you can park your cars, and then you just hop right on the highway and you can pretty much get anywhere you need to go. But also it's just really close to the hospital. You walk 5 minutes, you're at our YDA clinic. You walk another 5 minutes, you're at the main hospital, you're in our path room, you're anywhere that you need to go. And all the apartment buildings are really, really beautiful and nice and new, and it's great. We absolutely love it. Also, if you have pets, very pet-friendly apartments and a lot of places to take little walks with your dog, which is an aspiration for me at this point.
I really love New Haven. I have 2 beautiful daughters, and I think New Haven is a great place to raise your kids. The hospital has a fantastic daycare that both my kids go to. There's plenty of parks, plenty of family-friendly restaurants, and there's really a lot to do. I really love New Haven.
I grow random vegetables in my book. My most recent pride and glory is this weird zucchini pumpkin I have grown. It's the size of a large baby and it tastes delicious.
Hey, I'm Noel.
And I'm Maggie, and I just roasted Noel at Settlers of Catan.
No matter where you go for residency, you're going to read textbooks, spend time in clinics, treat hospitalized patients, and learn the ins and outs of dermatologic surgery. But to be able to do these activities with your friends is a unique privilege. Our faculty members prioritize a culture of collegiality and believe that the happiest residents are the best residents. Whether we're swimming in our associate program director's pool, picking seasonal fruits at one of our several local orchards, or spending quality time with each other's pets, we're reminded daily just how lucky we are to be part of the Yale Derm family.
This program has been everything I wanted and more. My co-residents are the best people that I could ever have hoped to train with, and we're learning from some of the best experts in the field who are not only intelligent, but they're also kind, and they're really incredible teachers.
We really just can't get better training, and that's what we're all here for. But at the same time, we have such a wonderful, we call it the Yale Dermatology family, and it really is a family. It's such a wonderful culture, wonderful group of people. All the residents love to hang out together. We have lots of fun things we do in New Haven.
It's clearly the best place you could pick